Recent initiatives by the Robert Crown Center for Health Education, a not-for-profit organization based in a suburb of Chicago, in conjunction with our Addiction Center at Rush University, is providing what I believe to be an excellent template for this goal. The Robert Crown Center is developing a completely new educational framework that integrates knowledge-building strategies for middle school, high school students, school personnel, and parents. Our center provides access to cutting-edge brain research. Thus, the prevention program includes both the neuroscience-based knowledge of how abused drugs act on the adolescent brain, as well as the social economic learning required to reduce drug abuse among our youth.
Is there anything more that you would like to see us doing here in Washington that would help to help the research that would feed into these programs, or in the helping to disseminate the findings of research and get this out to people?
There's always room to grow and help needed. From my perspective, in working with these outstanding educators, one of the things that we really are trying to do is determine if outcomes, are we really making a difference with our new curriculum? So we have several schools that have served as beta test sites in the Chicago metropolitan area, and we're just now getting feedback from our first year of implementing this curriculum in different schools. What we need to be able to do is to customize this curriculum to the individual community schools and then determine if we're as effective in the different environments, because clearly the way we're going to reach children, for example, in rural areas is going to be quite different than what we're going to be needing to use in the suburban parts of Chicago. So this kind of epidemiology and this kind of validation of outcomes support takes money. We have to hire people to do this. We have to have researchers employed. And so this, again, is an area where grant support mechanisms could be very critical in driving a momentum to get this thing to the schools as quick as we can.
And is what about the funding for the research that's going on to learn more and to improve these educational programs? Is there I know there's always a need for, you could say, for more, but is there anything that's missing, anything that can be done differently?
Well, there are mechanisms for this kind of educational directives, if you will, through both the NIH and at NIDA, as well as NSF. And I think that what we need to do is to take those vehicles and optimize them. One idea that we might explore, actually, as you know, all of these programs have training grants. So we're putting young people in their PhD programs on training grants that are being supported by NIH. One of the things we might consider to do is that there would be a component required of these training grants to have these students volunteer. And this could be part and parcel to their training and part and parcel to the institutions getting the grant awarded. And I think that kind of infusion of these young these are young men and women who are going into the neurosciences, who are right out of college, and having them work in these different high schools and junior highs would be a huge infusion of great knowledge and an understanding that would be very useful in these kinds of programs. So that's something that might not cost so much money, that might be very effectual.
Great. Thank you.